health officials are declaring monkeypox as an imminent threat to public health. The virus, spread through physical contact, can develop flu-like symptoms, and its initial impacts can last as long as 4 weeks. According to the CDC, monkeypox cases have been reported this year in 71 countries, where it was previously unknown or unreported. As cases rise, the virus is threatening to crash the economy even further after the hardships of the COVID-19 pandemic. The World Health Organization has declared a public health emergency of international concern, designed to prompt a coordinated international response. The last time the World Health Organization made such a designation was in January 2020 in response to the COVID-19 outbreak. The World Economic Forum's head of health and healthcare, Shyam Bizan, says that with this declaration, countries will need to invest significant resources in controlling this outbreak. To date, more than 16,000 cases have been reported in more than 75 countries, and the number of confirmed infections has risen 77% from June through July. Many cities around the world are on high alert. Last week, New York Governor Katie Hochul declared a state disaster emergency over the continued spread of monkeypox. She said the emergency declaration would lead to swifter response and better vaccination distribution. If it gets worse in a city like New York, then the whole world is at risk. The White House is trying to get the monkeypox outbreak under control as the number of cases is rising. Parts of the U.S. are coping with dangerous floods, which have become more frequent, partially due to the climate change. And tech companies are facing various challenges due to the economic downturn. Europe is currently the epicenter of the monkeypox outbreak, reporting more than 80% of cases worldwide this year. There have been no deaths reported from the virus outside of Africa, where there have been 5 to date. While considered high in Europe, many officials say the global risk remains moderate and is unlikely to disrupt travel or trade. Robust surveillance, contact tracing, and infection prevention and control has ensured that health authorities can rapidly report and communicate on this outbreak. The virus was first discovered in 1970, and previous cases had mainly been in Africa. Cases outside of Africa have historically been rare, traced back to infected travelers or imported animals. The monkeypox virus is a type of orthopox virus in the same family of virus that causes smallpox. The symptoms of monkeypox are similar, though less severe and less contagious than smallpox. Cases often appear in tropical climates and rainforests, where there are animals carrying the virus, including types of squirrels, dormice, and certain types of monkeys and rats. The disease is transmitted through bites, scratches, or bushmeat preparation. Human-to-human transmission is limited, and the virus is transmitted through direct contact with bodily fluids or skin lesions, as well as indirect contact with lesion materials through items such as contaminated bedding or clothing. It can also spread through respiratory droplets, but does not travel easily by air and requires direct, prolonged contact with someone who has an active rash. Monkeypox usually presents with a fever, rash, and swollen lymph nodes. Early stages involve headache and backache, sore muscles, and lack of energy. Individuals with the infection will also often develop a rash 1 to 5 days from the onset of symptoms, starting as raised spots before turning into fluid-filled blisters, which ultimately turn into scabs and fall off. All individuals who have tested positive have had the infection confirmed by a PCR test. Genomic sequencing was also used to confirm a case in Portugal. So far, Jynneos and ACAM2000 are 2 vaccines that may be used for the prevention of monkeypox virus infection. The availability of a vaccine is encouraging news in the fight against monkeypox. But as with COVID-19, equitable distribution and access to vaccines will be a key challenge globally, due to uneven rollouts and uptake rates between high-income and low- and middle-income countries. To counter this challenge, the World Economic Forum, in partnership with the Coalition for Epidemic Preparedness Innovations and the U.S. National Academy of Medicine, has launched the Distributed Vaccine Manufacturing Collaborative. The collaborative addresses inequitable vaccine access by supporting the establishment of a sustainable and robust global network of versatile vaccine manufacturing facilities capable of producing vaccines to protect individuals in pandemic and non-pandemic times.
Don't forget to leave a like and subscribe for more.
World of Finance TV has videos every Monday and Friday.